How long does it take metformin to work? Part 2. The most common metformin side effects usually do not necessitate medical care. These are some examples. Diarrhea. Bloating is not caused by weight gain, stomach ache, constipation, headache, gas, loss of weight, vomiting or nausea, heartburn. In the mouth, there is an unpleasant metallic taste. The most prevalent side effects of metformin are gastrointestinal side symptoms such as diarrhea, nausea, and vomiting. Patients are most likely to encounter adverse effects when they first begin taking metformin or when their dose is increased. Side effects usually fade or become less severe as the body adjusts to metformin, which takes around 2 weeks. Many patients are given the immediate-release version of metformin because it is less expensive than the extended-release version, although the quick-release version is more likely to induce negative effects. Patients who have negative effects when taking the instant-release version of the medication should consider switching to the prolonged-release form of the medication or taking it with a large meal. Although the majority of persons who have side effects while taking metformin will have minor side effects that do not necessitate medical attention, metformin is sometimes linked to serious adverse effects that necessitate emergency medical attention. These adverse effects, albeit uncommon, have occurred on occasion. The most significant adverse effects of metformin are lactic acidosis, low iron levels in the blood, anemia, and low blood sugar, hypoglycemia. Each of these side effects necessitates prompt medical intervention. Frequently asked questions. Why does metformin cause diarrhea? The molecular mechanisms underlying metformin diarrhea appear to be due to increased intestinal chloride secretion from the apical chlorine ducts. It is a semi-regulated process through a counterbalance mediated by AMP-cAMP and AMPK. When to start metformin? In the absence of specific contraindications, we suggest metformin as initial therapy in most patients. Grade 2B. See metformin above and glycemic efficiency above. We suggest starting metformin at the time of diabetes diagnosis. Grade 2C, as well as consultation for lifestyle intervention. What does metformin do for insulin resistance? As an insulin sensitizer, metformin helps decrease insulin resistance. Cells can absorb and use sugar more efficiently, reducing the amount of sugar in the blood. What is metformin for PCOS? Metformin is an effective ovulation induction agent for non-obese women with PCOS and offers some advantages over other first-line treatments for anovulatory infertility, such as clomiphene. For women who are resistant to clomiphene, metformin alone or in combination with clomiphene is a next effective step. What is the difference between metformin and Januvia? Although both drugs can cause serious side effects, There are fewer side effects associated with Januvia, and the drug is better tolerated than metformin. Januvia is not available in generic form and is considerably more expensive, while metformin is affordable for most patients. What is lactic acidosis? Metformin. Metformin is associated with lactic acidosis in patients with conditions that by themselves can cause lactic acidosis, heart failure, hypoxia, sepsis, etc. But it is impossible to determine to what extent, if any, metformin may contribute to the development of lactic acidosis in an individual case. What is the difference between metformin HCl and metformin ER? Metformin and metformin ER are the same drugs, except metformin ER is the extended-release version. This means that it should not be taken as often. Regular metformin is sometimes called IR metformin for immediate release. What is metformin made from? Metformin is basically a refined herbal medicine derived from a flower called French lilac, Glycemic Efficiency. In Europe, the French lilac is also called roux de chèvres because goats don't like it. It lowers their blood sugar levels too much. It has been used as a medicine for diabetes by healers for centuries. What is metformin ER? Metformin, which is sold under the brand name Glucophage among others, is the first-line drug for treating type 2 diabetes, especially in overweight people. It is also used in the treatment of polycystic ovary syndrome. It is not associated with weight gain and is taken by mouth. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.